And once again, good morning for anybody just joining us. We're happy to have you with us. This is the May Connect OC Coalition meeting. Encourage you all to introduce yourself in the chat, and we'll get started in just a couple of minutes. All right. Well, good morning, everyone. Again, welcome to you all. Welcome to everybody who's just joining us. So this is the May 2024 Connect OC Coalition meeting. It's nice to have you all with us. My name is David Pattison. I'm a project coordinator with Partners for Wellness. Partners for Wellness is the umbrella organization, and Connect OC is the program. Connect OC is the coalition here. And a few things. We're happy that you're all joining us. Please, we encourage you to introduce yourself in the chat. Name, who you are, where you're coming from. If you'd like folks to be able to contact you outside the meeting, please feel free to include your contact information. Connect OC is, as I mentioned, a program of Partners for Wellness in partnership with the Orange County Health Care Agency. Our focus is promoting existing mental health resources here in Orange County for TAY, transitional age youth, ages ages 12, 24. And we are really focused on helping reduce the gap in access of services by promoting better knowledge and understanding and awareness of the resources that are out there and how to access them for that age group and for those who love and care for them and support them in various ways, including especially local colleges and universities. So we're excited to have you all with us. This coalition meeting is the last Friday of every month, with the exception usually of December. This month, first off, Happy Mental Health Awareness Month. We are excited to feature today a presentation from AIM Youth Mental Health. They are a fantastic organization. They have a fantastic program. And what I'm really excited about sharing with you all is, it being Mental Health Awareness Month, we really, a strong value here for Connect OC is empowering youth to do mental health work for themselves and for their peers in the community, right? And AIM, this is the heart of what they do, and they do it in a really fantastic and creative way by training youth and young adults to be peer researchers. So we've had a theme in the last couple of our coalition meetings about data and the gathering of data about a particular population. In March, we talked about the Vietnamese community. In April, we talked about the Black community here in Orange County. And developing and accessing and promoting data in a way that is consistent with the needs and values of that community, that comes from that community, that population, and that in a certain sense is owned by that population. And so really it's information, as the phrase goes, right? Nothing about us without us, right? And so AIM is really doing that by empowering youth and by empowering young people to do that for themselves. And so I'm excited for you all to hear about that. First and foremost, as I'm getting ahead of myself, I'd love to give the rest of the Connect OC team an opportunity to introduce themselves, and then we'll dive into our presentation for this morning. So, Crystal, I'll pass it off to you.
Yeah, thanks, David. Good morning, everyone. Thanks again for joining us today. I am Crystal Bleischer. I am the program director with Partners for Wellness and Connect OC. Sarah, I'll throw it to you.
Good morning, everyone. I'm Sarah Chelliserry. I'm one of the health educators on the Connect OC Partners for Wellness team. And I'll pass it to Vivi.
Morning, everyone. I'm Vivi Vu, and I'm also one of the health educators on the team. I'm excited to be here.
Well, welcome again, everyone. I will hand it over to, well, first of all, I'll introduce to you our presenters this morning, give them an opportunity to introduce themselves, and then I'll pass it off to Mariana. So, Mariana, if you wouldn't mind introducing yourself, and then we'll go down the line and we can dive in.
Sure. Thank you for that wonderful introduction, David, and thank you for having us. I'm Mariana Jiminez, and I'm the program director for the AIM Ideas Lab at AIM Youth Mental Health.
Great. Nice to have you. And then Connie.
Good morning. I'm Connie Cumming. I'm the administrative coordinator for AIM Youth Mental Health, and I'm also the lead for our Art for Awareness Design Challenge that we do annually.
Great. And I'm just following our order from earlier. Alissia, if you wouldn't mind introducing yourself.
Hello, I'm Alissia. I'm a senior at Westview High School, and I was a part of Mariana's research cohort for AIM.
Great. And Jayanthi.
Hi, I'm Jayanthi, and I'm also a senior at Westview High School, and I was a participant of AIM Ideas Lab.
Fantastic. Thank you all for joining us. So Mariana, I'll hand it off to you and let you take us from there.
Amazing. Thank you. Let me just share my screen right here. Okay. Can you guys see that okay?
Yeah.
Okay, awesome. So I'm going to start off just by talking a little bit about AIM and what we do. So AIM is a nonprofit based in Monterey, California, and for the last 10 years, AIM has been bridging the gap between research and access to care for youth struggling with their mental health. AIM finds, funds, and implements evidence-based treatments, raises awareness about mental health in our youth communities, and empowers youth to discover their own mental health solutions. We also train caring adults to provide a safe and caring space for children, teens, and young adults, and we've recently started training teens as well to be able to support themselves and their peers. And AIM has a world-class scientific advisory board that informs our programs and also guides our investments by evaluating strategies for implementing evidence-based treatments that emerge from the research that AIM funds. Okay, so I'm going to hand it off to Connie to talk about one of our programs, which is the Design Challenge.
As an administrative coordinator for AIM, I have the pleasure and the privilege of receiving all of the art submissions for this year's Design Challenge. We received over 200 submissions from local Monterey County youth, as well as Orange County, the East Coast, and from as far away as Australia. The level of talent and creativity that was displayed was inspiring as well as very impressive. But it is the images themselves that really speak to the voice of our youth and what they are experiencing. The challenge is open to 6th through 12th grade students. It can be digital or traditional art medium. They can submit more than one entry if they'd like, as was the case with one young lady who wanted to choose multiple posters in the hopes that at least one would reach out to someone and teach them about AIM and to aid in mental health awareness. The motivation for the design challenge was to open the dialogue on youth mental health. And I heard from several of the instructors, their teachers, that the dialogue was open and the youth were very positive about speaking about their own challenges in mental health and listening to their peers and what their struggles were as well. It's also to help reduce the stigma and encourage empathy, and to focus awareness on the voice of our youth regarding the challenges that they face today. Only they know what they're feeling and what they're going through. So listening to them and the images that they shared get to give us a glimpse into what that is. Next slide. So these two images that I'm sharing here are from two students that said the art itself was healing for them. The traditional art on the left, she said that when she struggles with her mental health or through anxiety, depression, she uses art as a means to help heal herself. She finds peace in it. It's her way of escaping. The young lady on the right is a digital entry, and she said that this piece was her way to find closure within herself and let go of the negative thoughts and feelings after a very difficult period in her life. And it's difficult to see, but the blob on the ground has a lot of negative words and thoughts that she was able to release and improve her mental health. And she wanted to share that. The next slide, please. These two traditional art pieces wanted to share the intensity of their own emotions. The young lady on the right wanted to show how she glued herself together, sewed herself back together, and felt the stress of being hurt or broken. She wanted to give a voice to those who may not know how to express what they're going through in her own art piece. The traditional piece on the right was from a young trans student, and he shared that he wanted to show how intense anxiety can be. Next slide. Yeah. These two pieces were artists who wanted to share their own camaraderie in the feelings that they have experienced or those around them. The one young digital artist on the left said, "I aim to capture the raw emotions faced by those who are affected by overdose while advocating for compassion, support, and understanding." The traditional art on the right, she wanted to create a piece that shows how many of us feel inside. We feel trapped in a well, feeling like it's too hard to get out and reach for the help that we need. Next slide. These two pieces, one traditional on the left, was submitted by a young lady who had lost a dear friend, and she spiraled into depression herself and struggled with that loss. She chose that, or shared that she, after losing her best friend, she wanted this art piece to commemorate the beautiful memory of her friend, and that allowed her to work through the grief. The digital entry on the right side was just someone who wanted to share that many struggle with thoughts of suicide, and putting herself in that picture, even myself. So the message of "you are not alone" comes through in a lot of the pieces that were entered in the contest. And the next slide, please. These were middle school collaborations from New York. And one of the artists in the traditional piece on the left said that his artwork was inspired by his friend who sadly passed from suicide. "I never knew he thought like that, and I think if he would have talked about it, maybe the outcome would have been different." The other traditional collaboration on the right said that she shared she wanted to send this piece to those who were struggling. She wanted to show them it's okay and it is important to get help. "I wanted to portray the reality to show the world how important the meaning behind this contest is." And then next slide, please. So this was our overall winner from Australia this year, and she wanted to share that you're not alone. It's okay to not be okay. She also wanted them to know that it's okay to talk about your feelings and reach out for help. This was an example of, she didn't experience the mental health struggles that her peers did. And so she spoke with them, getting that dialogue going to find out how they were feeling. And she wanted to represent that in her art piece. There were many stories of instructors sharing what happened in the classroom. One that impacted me was a young lady who on any given day in the classroom struggled to even participate. And her teacher was surprised and moved that this young lady chose to participate in the Design Challenge art piece, submitted her art based on her own experiences. She even attended the reception event that we hold at the end. And I had the privilege of meeting her, a very nice young lady. So you can see that a lot of these images speak for themselves, but in the entry forms, we also ask for their message, what inspired them in their art piece, what message they would like to share. We had other quotes I would just love to share. To raise awareness, encourage others to ask for help. One shared that if you aren't drowning, it can feel like an inconvenience to try and ask for help. I wanted to show that there is hope. I want people to see my art and to keep going and not give up. So this is just a small sample of what we received from the youth. There's a common theme of eyeballs watching you, of being trapped in a cage. Many similar images come through a lot, but they're all very unique and very powerful. And we need to listen to this voice of our youth. Thank you.
Thank you, Connie, for sharing all of those. I think we can all agree that they were extremely powerful, and I think demonstrate the importance of kind of giving youth back the ability to tell us what they need and how they're feeling. Okay, I'm going to continue talking about the programs that AIM Youth Mental Health has. So we offer mental health first aid training. We partner with the National Council of Mental Wellbeing to provide both youth and teen mental health first aid certifications. And the youth mental health training trains adults and introduces common mental health challenges for youth and teaches a 5-step action plan for how to help young people both in crisis and non-crisis situations. The teen mental health training is open to those who are under 18, and it covers how to open the conversation about mental health, common signs and symptoms of mental health and substance use, the impact of school violence and bullying on mental well-being, and teaches youth how to seek the help of a responsible and trusted adult when they need it. So it really provides the tools for teens to understand what it is they're going through and for them to be able to support themselves and their peers in a healthier way. And you can learn more about both of these on our website and sign up for trainings there. Okay, so I'm the program director for the AIM Ideas Lab, which is the program that Alissia and Jayanthi participated in. And it's a youth participatory action research program that was designed to elevate the voices of youth in discovering their own solutions to emerging mental health issues and advocating for programs, research, and public policy to address those issues. So through this program, we try to improve participants' understanding of scientific research, mental health topics, as well as advocacy skills, while also helping participants maintain their own well-being throughout the program and hopefully give them tools to take on after they leave the program as well. And participants are sorted into cohorts of 10 to 15 students, and they work with a trained mentor that guides them through the program. In the first week, it's an introduction to research and youth participatory action research. So we really try to demonstrate the difference between traditional research, which is thought of to be in a lab. My background's in chemistry, so I'm familiar with like being in a lab. So now it's interesting that we're doing research in our communities. And I think it's really important for these students to know and feel empowered that they are making a difference in their communities with this research. The second week, we brainstorm together and narrow down the topics that students want to focus on in the survey and think about what are the questions that they want answered. What is the kind of information that we want about this community, and what are the problems that they want to address? In the third week, the AIM youth researchers review and give feedback on the survey before it's finalized. And they also create the introduction and develop a plan for fielding the survey, as well as how they want to debrief the respondents of the survey. So as you know, this is a sensitive topic, so we want to make sure that both the AIM youth researchers and the respondents of the survey are safe and comfortable, and that our AIM youth researchers are equipped to answer any questions that may come up during the process. The fourth week, we dive into data analysis. So we teach participants how to analyze the kinds of data they'll be seeing, both quantitative and qualitative data, and start to understand how to develop the insights and recommendations based on the data that we would get back at the end of the survey. Weeks 5 and 6 is the time when students are fielding the survey in their communities. So some of them are able to field it in their schools with school approval, but a lot of it is word of mouth, social media, and this happens over the course of 2 weeks. After that, the data is analyzed and students are able to start thinking critically about the survey results and start to develop these insights and recommendations based on the data that we're seeing. A preliminary report is then put together and students are encouraged to share this with their friends, families, teachers, and their communities. And I would argue that that is one of the most important parts, is being able to share this research. So we're really grateful to be able to be here and share their findings and for them to be able to share their recommendations with you. So like I mentioned, the AIM Ideas Lab has trained mentors that facilitate open discussions about mental health and guide the students through the 8-week program. They educate and raise awareness among the youth on mental health topics and train them on conducting and analyzing scientific research, and really focus on creating a supportive environment for these students to discuss the context of the research they are conducting, which is a sensitive topic. And it provides an opportunity for student-led service learning through research on their communities, which leads to kind of the through line of the program, which is that empowerment and amplification of the youth voice in finding those mental health challenges that are affecting their communities, as well as finding avenues for them to share their research. So the Ideas Lab was, I guess, thought of in 2021, but the first Ideas Lab ran in 2022. And we had 67 participants. In 2023, we had 69. And then this last Ideas Lab that ended in March, we had 90. So we've been super excited to participate in 74 different schools and garner over 3,000 survey respondents. This was the first year that we had an Ideas Lab in San Diego, and we had participants from over 19 different schools, which was super exciting. And I would say that this, I guess, success in San Diego was largely due to parents and communities advocating for these kinds of programs to be in their kids' schools and for their kids to be engaged in something that is going to benefit them and their communities as well. And so kind of on that topic, we've been working with schools to kind of develop more long-term collaborations to investigate these problems in their school systems, understand the state of their students, and generate solutions for improving district outcomes based on the results of their research. And peer-to-peer research is the key in these kinds of partnerships because they drive much greater engagement and they actually provide better data. Since the research design is informed by the community it is about. I'm going to talk a little bit more about youth participatory action research just to give you a little bit more context before we dive into the research results. So David, at the beginning of the meeting, I really liked that you mentioned the statement, "Nothing about us without us." And I think that is the through line of this kind of research, really based on the needs and interests of the community, and young people and their communities establish how they're active experts on their own conditions, their experiences and their values. And I think that's kind of what Connie was saying as well. They really hold the answers to what we need to do to address some of the youth mental health crisis. And so in youth participatory action research, the research design is a mutually engaged learning process that's informed by these perspectives and their communities. And it starts by identifying the issues about which participants can relate to and identifying what it is they want to know, and kind of brings up that starting point for coming up with these solutions to the challenges that they're facing. It also shifts the traditional power imbalance of outsiders conducting research, since all of the researchers and participants have equal roles in planning conducting and interpreting the research results as well. So our youth researchers bring the context of their own experiences to inform our research design, how we field the survey, and how we analyze the data as well. And like I said, it does lead to gathering better data that directly benefits the community, since it is rooted in and follows their needs. And it's a really community building research process as well, because it's an ongoing process. It's an ongoing exploration and reflection and taking action based on these research results. And by sharing these findings and collaborating with community partners like ConnectOC, the data gathered can inform programs and community development, influence policy, and raise awareness for these issues. It elevates the voices of individuals that may not otherwise be able to advocate for their communities. So it's really important to be able to give youth the opportunity to voice how they're feeling about this, what they want to know, and what, I guess, let us know what we should be doing in order to help them. It's driving change from within and empowering people, particularly youth in the Ideas Lab, to affect positive change by participating in research for the communities. And I'm going to pass it off to our two incredible high school senior youth researchers, Jayanthi and Alissia, to present some of their findings from the 2024 Ideas Lab that ran in San Diego. It just ended and they did an incredible job throughout the program, and I'm super excited for you guys to see what we uncovered.
So one of the questions that we asked teens with our survey is, what factors worsen the mental health of teens? We found that academic pressure was the most prevalent, followed by pressure from parents, comparisons to other people, the lack of sleep, and finally the lack of a school-life balance. Academic pressure comes to no surprise for me, because we know of the pressure that comes with AP classes, grades, college, and the pressure to get into a good college. At this point, for teens, school sort of becomes our life. Therefore, our peers urge for policymakers to prioritize student mental health by regulating and limiting academic workload outside of school hours. As for the pressure from parents, parents can be some of our biggest supporters, and that's why it's important for parents to understand the best ways that they can support us so that we feel supported. Our fellow peers recommend for parents and caregivers to actively engage in open discussions about mental health with their teens, which would complement the information provided at schools and foster a supportive environment. Additionally, one student even commented that they wanted for parents and guardians to not have old-fashioned ideas about mental health and to try to be more helpful. Our peers had recommended for parents and adults to prioritize understanding and educating themselves on how to provide unwavering support to children during both favorable and challenging times. For the next three factors, I'll talk a little bit about each one, and then I'll give the recommendations at the end. For self-esteem, one of the most reasons why teen self-esteem is most negatively impacted is because of comparing themselves to other people. During our survey, this was the factor that was most prevalent in negatively impacting self-esteem, and which nowadays is even easier with social media. As for the lack of sleep, I've known countless of students who always talk about how they have slept less than 7 hours of sleep every day. It's common to walk into a classroom and for people to comment on how they've been staying up into the early mornings, working on school project, on homework, studying for a test. And oftentimes students are also staying up because they felt like they didn't have enough time for themselves, free time, during the school day or after school. And so they compensate for that by staying up a little bit later in the morning. I also know countless students who rely on coffee at this early age in order to stay awake each morning. As for the lack of a school-life balance, no one taught us how to balance school and life, and that's why many struggle with this skill, including me. For our recommendations, our peers recommend for us to implement policies that prioritize work-life balance and reduce academic stressors such as homework load and exam pressure. This is in order to create a more supportive environment and conducive learning environment. We also recommend to introduce comprehensive mental health educational programs to increase awareness and provide coping strategies for youth facing academic pressure and parental expectations and other stressors. Lastly, us teens recommend to offer accessible and confidential mental health support services within school settings to provide timely assistance to students in need.
Following up on Alissia's point regarding academic pressure, we found that 77.5% of teens say that school interferes with their self-care, emphasizing that schools should work to foster a healthier environment for students. And I think the high percentage of students who agree with this statement is likely due to factors such as heavy workloads, with students often spending hours outside of school working on homework, numerous extracurriculars, and the pressure to obtain high grades, all of which contribute to the limited amount of time that teens spend focusing on their mental health. Additionally, our survey found that 76.8% of teens feel that their school should do more to help manage student stress and support mental health, suggesting that schools may not be offering enough mental health resources or simply aren't effectively addressing the root causes of student stress. And personally, at my own school, I've observed that there are a lot of mental health resources offered on campus, yet many students are unaware of these resources and therefore feel as though they aren't receiving support. And oftentimes, I believe that the issue isn't exactly a lack of resources, but a lack in awareness of these resources, or in simply feeling comfortable enough to reach out. And some potential solutions that could be implemented within schools to address these issues include the ability to take mental health days rather than only sick days, because I think this would help to reduce stigma surrounding mental health by normalizing the ability to take a mental break from school. Also, less emphasis on grades and reducing the amount of homework would allow students to actually enjoy learning and not be spending hours on busy work. And finally, I think more resources during stressful times, such as during finals or college applications, would be great because that's when students are struggling the most. And for example, at our campus, we have something called Love on a Leash where they bring therapy dogs for students. So I think activities like that would be really helpful.
Another question that we asked teens during our survey was who are they most likely to reach out to for support during a challenging time? We found that teens are most likely to reach out to people close to their age. And so on the very likely side, on the right side of the spectrum, we have significant other, followed by friends, and followed by no one. And then on the very unlikely side, we have school counselors, followed by teachers, followed by other adults at school. So it makes sense that teens aren't going to be really reach out to an adult figure because it's a figure that they've never really opened up to before, and it can feel kind of unfamiliar and a little bit uncomfortable. And a reason why students may not reach out to people in general is because they have a fear of being judged or they lack of a supportive network. And so some recommendations that us peers came up with were to offer workshops for parents to educate them about teen mental health and equip them with strategies in order to support their children effectively. We also encourage regular mental health check-ins among friends and peers to promote mutual support and awareness of each other's well-being. We also recommend to foster open and non-judgmental dialogue with teens to create a safe space for discussing mental health challenges when seeking support. And finally, to provide diverse resources and support systems to reassure teens that it's acceptable and encourage to ask for help when needed.
So as displayed in the previous slide, teens are often hesitant to reach out to adults, especially school counselors or parents when it comes to asking for mental health support. And From our survey, we found that the reason a majority of students are reluctant to reach out for support is because of the feeling that their problems aren't valid or aren't worthy of attention. And personally, I've experienced this feeling, and I know many of my classmates have likely felt the same way because we often feel as though other students are facing worse problems than us and therefore deserve to be heard. But in reality, everyone deals with struggles, and all of us could benefit from having another person listen to us. In order to encourage teens to reach out when in need, I believe that schools should work to normalize help-seeking behaviors and ensure that teens are aware that their problems are valid, no matter how big or small. Additionally, many teens are often unsure on how to go about asking for help and wish to have a better idea of what to expect after asking for help. This suggests that the importance of providing mental health education to teens in order to encourage them to seek help and increase their awareness of the numerous resources that are available.
Finally, we found that 70.1% of teens agree that mental health education should be included in the K-12 curriculum. We believe that this could help to normalize and prioritize mental health awareness from an early age, and this could help decrease the stigma around mental health and make it easier for students to reach out for help as they're growing up. During the AIMS Idea Lab, we also questioned the fact that physical education is a part of the K-12 curriculum, but why isn't mental health also a part of the curriculum? Especially with this information that we are presenting, we are showing that how prevalent of a problem mental health is at school and how crucial a solution is needed in order to help assist students with their well-being.
Thank you guys so much for sharing all of that research. You guys did an incredible job. And I would love to hear a little bit more about how the experience of doing research was, and if there are any parts that stood out to you about what you guys found.
So personally, I ended up joining AIM Ideas Lab because mental health is so relevant to my own life and that of my friends and peers. So I viewed it as an opportunity to problem solve potential solutions that could benefit both myself and my classmates. I really enjoyed working with other students to conduct this research, as it was very interesting to hear the perspectives of teens from different backgrounds and different schools, because even though we're all similar in age, we all have our own experiences related to mental health, and diverse perspectives is also an important factor in research. I believe that data in youth mental health is important for understanding what teens are struggling with the most and what prevents them from asking for help. And having a better understanding can help us come up with more effective solutions on how to address the youth mental health crisis. Having teens be a part of researching this issue is powerful, as it allows them to recognize the issues which their own peers are facing and be a part of the solution. Also, since teens are dealing with these struggles themselves, they're able to contribute more insight on how to approach collection and analyzation of data, such as choosing which topics to focus on within the survey, and potential solutions that can be implemented within their own schools. Not to mention, AIM Ideas Lab is a good opportunity for high schoolers to be introduced to research, which is relevant to their own community. And personally, I had the opportunity to be involved in scientific research, and I know that oftentimes when students think of research, they imagine research that's conducted in a lab, but that doesn't always have to be the case, and AIM Ideas Lab is a good example of this.
So I personally joined AIM because at the time I was struggling with my mental health and also struggling to support my little brother with his too. And so while I was trying to find a solution to help us, when I heard about AIM, I immediately wanted to join. And some of the things that I really liked about this program was that we have the opportunity to voice our concerns about mental health and also the concerns of our peers and tell people what we needed in order to help people help us. I also enjoyed being able to show with statistics that we are not the only ones feeling this way and that there are a lot of people feeling this way as well. The statistics also help to highlight certain factors that were really negatively impacted and to show how much help was needed in order to help alleviate these negative factors. I also liked being able to use the data that we found to apply it at my own school because I'm a part of a mental health club with Jayanthi. And with the data that we gathered, I felt like I had a better idea of how to help my peers with their mental health. I'm also a strong believer that strong student leadership is vital in order to keep some sort of change or initiative going at a school. And I also think that it helps to cultivate a community of students who advocate for issues such as mental health. I also found for peer-to-peer research, research with our peers on our peers, also impactful because it felt like we had some sort of control over the initiative that we were taking. I am lucky to also have this platform to voice my opinions and advocate openly with my fellow classmates because otherwise I would not have had the opportunity to do so. And so in conclusion, we are calling on the system to change because I don't think that school and learning should be something that people hate. And I think that a lot of kids could love learning if school wasn't so stressful. Thank you.
Thank you guys. You guys did such an incredible job, and I wanted to thank all of you as well for giving us this opportunity to share all the incredible research that our students have done. So yeah, if you guys have any questions, just feel free to ask.
Yeah, folks, that was fantastic. That was, I mean, the program is incredible. I loved just seeing the highlights. Jayanthi, Alissia, you both did fantastic. You were great representatives of your team and the research that you all did and the things that you all found out through that research and advocating for change in light of that research. So I can't say enough. You all did a fantastic job, and I'm really appreciative that you took the time to share your experience with us. And I feel inspired by it, and I'm sure that a lot of our other attendees, probably everyone, feels the same. On that note, and I'll open this up to anybody from the AIM team who feels that it would be appropriate for them to speak to this. But so I know that you all, the AIM is based elsewhere. You all have done work in Northern California and other places, San Diego. I'm aware, and I would welcome you all to share with our audience that you all are moving into Orange County to do some of this work here in Orange County, and I'd love it if you'd speak to that for a little bit.
Yeah.
Oh, go ahead.
You can go ahead, Lisa.
Thank you. Hi, everybody. My name is Lisa Delier. I'm the Director of Development for AIM Youth Mental Health. And I just want to say that thank you to everyone who participated in this amazing presentation. I learned a lot too. And as David mentioned, and Mariana mentioned early on, we are based in Monterey County, but we're super excited to be expanding our programs down to Southern California, particularly here in Orange County, where I am based. So I am thrilled to be able to represent here in Southern California, OC in particular. And I see so many familiar organizations and names on this call. So thank you all for joining us. And I am also here to answer any questions about how we can bring Ideas Lab and some of the other fabulous programs that AIMS offers to our community here in OC. And I will pop my email in the chat for you.
Great. Thanks, Lisa. Thank you all for a couple things. One, I want to open up to you all for anything else, any last words or things you'd like to share. I also want to say that for anybody who has any questions, this is a great time to ask them. Feel free to raise your hand, put them in the chat. At this point, I think also you can say, feel free to just unmute yourself and ask your question of our participants, our presenters this morning. You all did such a great job. There's nothing left to say on the subject. People are just awestruck. Great. Well, if you all do have any questions, thought I maybe heard somebody unmute themselves, but if anybody does have any questions, feel free to ask, feel free to send them in the chat, or if you have questions you think of after the fact, feel free to email me or anybody else in the ConnectOC team, and we'll communicate that to AIM. If you all would like to get connected and you miss Mariana or Alissia or Connie's emails, and they're there in the chat, I do believe. I know Lisa just posted hers. Feel free to also reach out to us, myself, or anybody else in the ConnectOC team, and we'll get you all connected. But again, one last time, Mariana, Connie, Lisa, Jayanthi, Alissia, thank you so much. This was really fantastic. I'm really excited about what you all have done, what you've accomplished. I mean, I think it's really wonderful, and what you are working to do. And I'm really excited to see it happen here in our community here in Orange County. So thank you all. Thanks for participating.
Thank you so much, David.
Absolutely. Yeah. Well, if nothing else, for our presenters, and feel free if you do have questions, I can come back around to it later. We'll shift now in move down our agenda. First thing I want to mention to everyone, if you look in the chat there from my colleague Crystal, we invite you all to complete the survey. As I mentioned before, surveys are how we get our data about how this program is doing, ways we can improve, things you'd like to see happen, that kind of thing, what's working, and so on. So I invite you all to take just a couple minutes to fill out the survey. Moving on to some updates about ConnectOC. Just to start us off, the first one, the big one, I think, for me, is our next meeting, our next coalition meeting in June is actually not going to be on a normal Friday. It's going to be on Thursday, June 27th. And more importantly, it will be our first in-person coalition meeting. Like so many things, this program started in February of 2020, we launched, and we had the intention of all of the work we were going to be doing was going to be in person. We were going to have you all joining us regularly in person for coalition meetings. And then this thing happened in 2020. And like everyone, we went online and shifted our approach. And in a lot of ways, that's been really fruitful. It's given folks an opportunity to join our coalition meetings from all over the county and from outside the county. And so that's not something we see ourselves totally moving away from anytime soon, but we want the opportunity to really just see you all face to face, to spend some time networking and connecting. And so that's what we're going to be doing on June 27th. We will be at the Behavioral Health Training Center in Orange. Thanks to our partners, the healthcare agency, for supporting us in accessing that space and this initiative. And so details, we're going to be starting at, we should have pulled it up in advance, but let me see here. Pull up my calendar. We're starting at 9 a.m. that morning, if I'm not mistaken. Crystal, does that sound right? 9 a.m.
I think realistically we'll start more at like 9:30. 9 a.m. gives us some time to kind of get in and get set up, but 9:30 to 11:30, that'll give us a couple hours.
Yeah. And what we'll do is we'll spend some time focusing on getting to know each other, spend some time networking, connecting. There'll be a really cool art activity from our partners, Laguna Playhouse. And we're going to spend a little time talking about some shifts that are going to be happening with ConnectOC, some changes that we're really excited about in the coming fiscal year as well. But number one is we're really excited to spend some time with you all. We'll have some breakfast items, some coffee, and spend some time together. So the details will be coming out. If you all receive our newsletter, you should have seen the details in the newsletter. It just went out yesterday. If you don't receive our newsletter, feel free to reach out to me and I'll get you on the list if you're interested. And either way, we'll be sending out a save the date and with the details and stuff with probably in the next week or so, week or two at most. But again, June 27th, probably about 9:30 a.m. at the Behavioral Health Training Center in Orange. We'll be excited to see you all there. Anything else, team, that I'm missing in terms of other updates for ConnectOC? Great. Well, then we'll open it up to you all. This is the time where we welcome everyone, all of our attendees. If you all have anything going on, any events coming up, anything you'd like to talk about, in that regard, we'll open the floor to you all. Feel free just to unmute yourself and share what you all might have going on. I also welcome giving not surveys, flyers to place them in the chat.
David, I have a question for you.
Yes.
So we saw a fantastic presentation, and the A program, the staff and the students did a wonderful job of sharing information and sharing data with us. We've seen data, we've seen the presentation. So here in Orange County, what do we do with that? How do we act on the information that was just shared with us?
That's a great question, Kevin. First off, I'll open it up to the AIM Youth Mental Health team. What are your thoughts? What do we do? Thinking too about your communities. What do we do with some of this information? I think I heard some fantastic suggestions from Jayanthi and Alissia, but what are some of your thoughts? And let's see, and we can see about how that might apply to our Orange County community as well.
That's a wonderful question. And I think that's kind of what is most difficult about this kind of work is we know what has to be done, and it's how do we actually change the systems that are in place. And I think that's something that Alissia and Jayanthi touched on too. And I would say that kind of just building these relationships with these schools to try to implement these policies that students are recommending, and backing it up with this data and the statistics would kind of show like, yes, this is what they're asking for, this is what they need, and this is what would be helpful. That would be
Thank you. And what we can do locally is if anyone on this call or in your networks wants to reach out to me, and I can coordinate with you to get these programs, to get the Ideas Lab into schools in Orange County, Mariana and I would be more than happy to make that happen. So that's what we need, is the power of community and the power of connection.
And we've been working with universities as well, providing them the AIM Ideas Lab results, specifically in university programs that are training future social workers or counselors that are working in high schools or with youth. So this data kind of informs how they do their work and how they show up for their students once they're in the workforce. We're trying to facilitate like more roundtable discussions as well with the AIM Ideas Lab participants and these like graduate and undergraduate students as well that will be working with youth, to kind of open up that dialogue between them as well. So there's a couple different ways that the Ideas Lab and this research could be applied in Orange County. And like Lisa said, feel free to reach out to her or I if you see potential for this.
I'm going to add one more thing to that. We are a nonprofit, so we need funding. So that is something that we also need to operate and to continue these wonderful programs going forward. And I am also the person to contact if there are any funding sources available, or if you'd like to learn more about how to support AIM and Ideas Lab and all the wonderful work and research that we do in Orange County and across Southern California, and as Connie mentioned, pretty much across the world.
Could I just chime in quickly too?
Absolutely.
So I'm Denise. I'm the grants manager at AIM. So full disclosure, I am a grant writer. So I really defer to the expertise of program directors like Mariana. And so I'm just giving that as a caveat of like, this is my perspective as our grant writer here at AIM. And I think the question of implementation is a very important one. And I really agree with everything that's been said so far, including Mariana's comments about systems change, continuing to work with schools. And I just wanted to add that, the kind of obvious other piece is programs like these are accomplishing some of, right? Not the whole goal, right? It's, it doesn't fix, the mental health crisis, but, we're talking so much about youth empowerment, about power dynamics, about, I think the role of psychoeducation is huge. And there's that phrase, you don't know what you don't know. And so I think many of us, youth and adults, are walking around kind of not knowing what we don't know about mental health, about, a whole range of things in that sphere. So I think that continuing to bring youth together, give them the tools, give them the information, and empower them through programs like this, and empowering the communities and the adults in their lives, the teachers, with the tools to have these really hard conversations. And I think that, for many, I'm 37, and I think for many of us, it's like we look back and it's like, oh yeah, no one spoke about this stuff when we were, young, and it can be very isolating to be a young person struggling with these things. So I just want to acknowledge, it's kind of an obvious observation, but just the power of bringing young people together and working to destigmatize, to open up the conversation. I mean, the art that we saw at the beginning, I don't know how it is for y'all, but that stuff makes me emotional. Like, that's powerful. And hearing from our young people who spoke today, you both did so wonderfully, and it's really inspiring. So yeah, I just wanted to kind of add that perspective.
Thank you, Denise. A couple of things that, I've heard so far. One, and I really appreciate this perspective. This is a kind of rubber meets the road kind of question. Is a funding question, right? So money to some of the recommendations were program related, right? And so there's always a question of funding, right? So that's part of it. And that funding question is not just about finding the right funding sources, although there are sources out there, and finding and accessing them, but also how we advocate for changing or shifting priorities where they need to shift, right? But also something that struck me is, one of the important, and this is for Jayanthi and Alissia and any team who hears about this, any young adult, that there is a lot of power in your voice, right? For school administrators, they've got people like me working at nonprofits knocking on their door all day. Let me in, let me do my program, let me in, let me do my program, right? Kind of thing. I'm funded to do this program, can I come in and do this program? Yeah, you and everybody else, buddy, right? But when they hear from their students, right, these are the things, especially, it's not just, this is my personal opinion as a student, as valuable as that is, but the fantastic thing about what you're doing is, here's the data. Data you didn't have to pay for, data you didn't have to do the work of discovering, and data straight from the mouth of the young people who are here. Here's the data about where they're struggling and what they need. What can we do to start meeting some of these needs? Because the reality is, especially here in Orange County, there's a lot of really good stuff happening, a lot of really fantastic programs, a lot of really good work that's happening at various levels of the education system, right? But so then the question of, then to what extent do these represent, and I think Jayanthi and Alissia, you made this point, does this represent a knowledge gap from my peers who I'm asking these questions, who just don't know that these resources are out there, right? Or don't know that it's actually safe and useful to access them, right? And I mean safe in that, like, just like they were expressing, like, the last person I'd probably reach out to is a school counselor or my parents or a teacher, right? The exact people that we spend a lot of time training to be the people who respond in these situations, right? But how do we help them see it's actually safe to do that, right? And make it safe for them to do that. And then, so addressing knowledge gaps, but then where we identify real gaps, oh, there's a need here, and there is no service or supporting support that meets that need. How can we marshal the resources we do have to meet that need? And or how can we find new avenues to meet that need? But all of that, I think, really does start with a strong and empowered youth voice. And so that's why I'm really excited about what you all are doing. I'll stop now.
So along those lines, David,
yeah,
when we're talking about really empowering and adding strength to their voice, the question I would have for the AIM team is, are there plans to have this data and have these results published in a peer-reviewed journal with the student's name attached to the article?
I actually love that you asked that question, Kevin. We currently just have them on the AIM website, but I'm fairly new to the team. I just started in March. But we have a really incredible scientific advisory board, and I've talked to several team members as well that one of my hopes is to work a little bit more closely with them to legitimize this research. And if we could get it published, that would be incredible, especially to be able to give these students credit and just the power of owning their research that they conducted in their community. So I really appreciate you asking that question, because that's exactly where I'm headed.
Essentially, Mary, you've already run a research study. You approached it from a very direct theoretical perspective. You had a very direct question to evaluate through the data and through the analysis. So it's just a matter of taking your results and writing them up and sending them out for publication, well, review and publication. But what I've seen today really appears sufficient to meet criteria for publication. So I think it's just a matter of doing the work. It's not if they can be published, it's what can we do to ensure that they get published at this point.
Yeah, thank you, Kevin. I appreciate that. Really lights a fire.
Kevin, can I thank you. Can we touch base maybe after the call here and with our team and see if there are ways that we can help facilitate that?
Yeah, I worked, well, I was a professor at Arizona State University for a few years before transitioning out here to California, and have some information on the publication process. I'm happy to support and give you what I know. Honestly, though, it's been 15 years since I've been in that world, so I don't know how much help I will be, but I will answer any questions that I can.
Thank you, Kevin.
Thank you.
And actually, I am I have research that is published, not in mental health. I've worked with the Cleveland Clinic on some projects, so I am familiar with the publication process, and I'm excited to work with the AIM team and kind of bring that to the Ideas Lab. So,
and psychiatric and psychological publications really function in the same way that they do in the other sciences. So the process that you used and you follow to publish in the other field, you can use that same. It's just a matter of where you're sending in.
Yeah, exactly. It's like it's strategizing how we go about it.
And which journals would really have the most value and establish the most significant validity and create a significant audience for the results as well. Okay, because part of what you do is that it's not just the publishing, it's what you do after the publishing that makes a difference. You get it in the journal, and then you take a peer-reviewed published research project and you present the data based on that. You take that to the schools, you take that out into the communities, and it adds more validity to the work that we're doing and really creates a stronger voice for our students.
Yeah,
absolutely.
The beauty of this kind of thing is that it has the power to make an impact from two directions, right? The fact that it is local data, right? And when, as you all are working here in Orange County, and we develop the similar kind of, data for here locally, there's a certain power in it being localized in terms of advocating with local administrators, local elements of the education system, and so on. But on the other side, in terms of making larger movement, in terms of informing the academic conversation, forms of making movement on a state and federal level, and even in the county level, right? When we're doing the work to, when programs like ours are going out for a grant and we are drawing from research, right? Peer-reviewed data to make the case, or even when folks on a higher decision-making level are drawing from data, from peer-reviewed data to determine how they're going to move policy-wise, this then becomes available to them at that level. And so there's a way of the power to influence policy and decision-making at two levels, right here immediately on the local level, and then on a higher level in terms of it being available in the body of peer-reviewed data that somebody might be drawing from. So I think it's really fantastic. But I also want to stick with, I'm anecdotally fully convinced that the things that you all highlighted in the data where you were will apply just as much here in Orange County. We need the data to show it, but anecdotally, the things that you all are identifying are huge. And one of the things that really struck me, like I said, is just this kind of, in some ways, topsy-turvy outlook from some of the peers that were surveyed in terms of who to reach out to when they're struggling. The thing that I don't know about everybody else, the thing that really sat with me, that really struck me, was that third from the most likely. So the responses are very likely who I would reach out to in a crisis or when I'm struggling. The third most likely option was no one. That kind of, honestly, personally, that kind of gave me chills, right? Because on the far likely side was like, okay, yeah, my significant other, and then a friend and so on. And then no one above school counselor, a therapist, my parents, school administrator, whoever else, no one. It's huge.
Yeah, see, David, that for me, that doesn't seem as surprising. I think it really speaks to, the data that we're seeing around suicide loss.
Right.
It's those people who are isolated and withdraw and feel they don't have a connection and they don't have hope. Those are the people that aren't reaching out and really don't feel they can connect with anyone else. So it really kind of reinforces the data and the information we have, and speaks to what we need to do as a community and where we need to focus our attention and energy.
Denise, I think that's exactly right. Kevin, I think you're right. And Denise, I think that's exactly right. Not surprising, but significant and scary, right? Because I think to your point, Kevin, that is often the source of a lack of hope that leads to things like suicide, right? Is that I don't believe that I can safely reach out to anyone, or that anyone cares, or that it will even matter if I do, right? And that's a huge place to start to move the needle, right? In empowering people. Something else that AIM is doing and that other organizations here in Orange County are also doing in really fantastic ways is empowering or educating peers to be an appropriate level responder when a peer is in crisis. Hey, appropriate level because there's certain limitations to that, but how do we empower them in the moment to respond in meaningful ways? And then empowering everyone else on that list to be the same. So if there are multiple points of access and entry to care. Yeah. I'm really appreciative, Kevin. I'm really appreciative you sparked this further conversation. I'm appreciative of everyone being willing to participate. Any other thoughts from our attendees about this subject? We do still have a bit of time allocated for our meeting, so I'd welcome any further discussion before we move back on to any partner updates. But any other thoughts or questions?
I just want to say thank you. This was amazing. This was fantastic. I mean, I learned so much, and being from the kind of development side of things, I don't necessarily get to hear all of this really interesting conversation and thoughts. And I too, David, got chills from that. So I want to thank you all for joining us today and having us and helping me learn, and I think helping the community get to a better place when it comes to youth mental health and the importance of this subject.
Great. Thank you all. I may have actually one more question, if I may, and this is for Jayanthi and Alissia, and I'd love to hear any thoughts you have on the subject. But one of the things that the data really showed a lot of that one of the in various ways a major stressor for your peers was academic pressure from in the academic setting, among parents, the workload, all of that. This has been like a subject, for a long time right now. When I can recall when I was in elementary school and junior high, there was the same sense. And it just seems to, despite continual warnings to the contrary, it just seems to compound and get worse with each passing generation, right? And so I'm wondering, what thoughts do you all have about how we might make some meaningful change? How can we support you all and your peers in relieving some of this pressure? What are some thoughts about how we might shift things around? Do you have any?
So I think one of the things that we could do is like get more people. So while we're in high school, we all have this vision of getting into like a really like top college. And so we prepare for that by stacking up on AP classes and doing all of these like extracurriculars and stuff like that. And because we know that college admissions are super competitive too, we feel like we need to do all that in order to get in. I think that if we heard from some alumni or like people from college to like tell us that you don't need to do all that in order to get into college. Like you don't need to get into like the top college. I think that could be impactful. I think another thing is that I think like selective college admissions, like although they might be like helping people get like smarter at school, like it's I think this might be a little bit a weird example, but I kind of think of it as like the economy kind of thing, like measuring GDP, but we can see the progress that the economy is making, but we're not looking at the GNH, which is the general national happiness. And I think that that's kind of like the same with schools. Like we look at kids are getting smarter, but they're not getting happier. And I think that if we are able to compensate with that and like develop healthy relationships with school, I think that that could actually help like skyrocket student learning because students will enjoy learning at the same time too.
I think it's a fantastic parallel. That's really well said, right? You know, that we are looking at one metric of success, one way of measuring success, and that is, are students performing well in the various elements we're doing? Are they performing well on standardized testing? Are they performing well in AP classes? And then are they getting enough extracurriculars? And is that translating to a certain rate of not just graduation, but college acceptance? And especially looking at things like college acceptance at a particular level, right? You know, top colleges, that kind of thing. We're not asking the question though, or not emphasizing with the same vigor the question of, are these students healthy and happy and thriving in other ways that are also just as much, if not more, indicative of will they be successful long term, right? In terms of their overall health. So I love the way you put that. Yeah. So some things you thought of that were, you know, can we start to break down this image that peers have in their mind of like, I have to do all of this and work so hard and do so much extra stuff so that I can get into the top college because I have to go to the top college. And what does it look like to start breaking that idea down a little bit and start helping folks see that maybe they don't have to do as much or work as hard in those ways, or work so hard that it's harming them in other ways, and that they can still be successful and thrive in the ways that are especially meaningful for them. Does that seem right? That's great. Yeah, well said. Other thoughts?
Well, I'll just personalize this a little bit because, you know, why not? Yeah, Alissia, what you said really resonated with me, in part because my son is in that same space and going through that same thing you're describing. He's 17, a junior in high school. He's been taking his full high school load with AP classes, honors classes, and then taking 9 units a semester at one of our local colleges, and really pushing himself to the point where he started struggling emotionally. He had overcommitted himself and was really didn't have the resources to function through all that he had taken on. And he had convinced himself that in order to succeed, this is all that he had to do. And fortunately, I do the work that I do, and I recognize the value of his emotional health and well-being, and I was able to support and intervene and get help for him that wasn't coming from dad, because, you know, who wants to hear dad tell you what to do? But really it was helping him, one, build the skills and the tools he needed to maintain resilience, recognize what his values are and where he wanted to go, what was really important for him. And kind of, as you described, you know, does he want to get into that program at USC, or does he want to pull back and take things a little slower and start off at the community college and then transfer over? You know, it's looking at alternative paths and seeing that the vision he has for himself today doesn't have to be the only vision and the only path to the future, but helping him see that and helping him find his way without so much pressure, without so much stress, and oftentimes just self-induced stress, because he believes that this is what the academic environment requires of him. You know, if he's going to succeed, this is what success looks like. So it's shifting perspective, shifting values, developing resiliency, still encouraging him to, you know, challenge himself and be successful and find success, but understanding that success looks very different and doesn't have to be one strict way. You know, it's all these tools, all these things, and lots of other stuff that we did to support him and help him find his way through this struggle and this path. But ultimately, the going through the struggle and having this experience for him was very rewarding. It helped establish more resilience. It helped him shift his rigid perspective and rigid approach to his own education. But you know, we're a very informed and very well-educated family in terms of mental health, and we were in a position to be able to help and guide him through this. Most families aren't in that same space, you know, but the pressures of the environment at school are very significant, and we need to find ways to help our students, help our youth find success, but not at the expense of their well-being.
Yeah. Right.
Actually, if we have a moment, having a son who's in his 30s, I just wanted to share his experience in that he had the same pressures, thought he needed to go to a high-powered school because of his grades, because of his drive, all of his student or fellow students, his teachers, people who knew him, expected him to go to a high-powered school. When he accepted going to just a state college that filled his needs, as a parent, I was kind of bombarded. Why is he going there? He could go here, he could go there. But we encouraged him to follow his dream. He is an entomologist. And so we said, just get the education that you think you need to further your passion. And he graduated from that school, went on, got his master's, aligned himself with like-minded people. He's finishing up a PhD, and he has 2 of his own businesses. He's happy. You know, he's traveling the world. He's doing what he loves. And if he had listened to the pressures that he was hearing from his instructors, oh, you're doing so well, you should be an engineer, you should be going to the top schools. I said, no, you smile when you talk about bugs. And that's what you need to be doing. And he has a very successful businesses and is doing what he loves. So you can come out the other side, ladies, and follow your passion and be happy. So just wanted to share that from the other side of the college realm.
Fantastic thing is that the both of you, what I hear is the ways in which you both advocated and are advocating for your kids, right? For their health, for their mental health, for balance, for focus on the things that really matter and have meaning for them, and not just whatever they feel pressured into doing or being by whatever is happening around them in the ether, right? Academically, their peers, otherwise. And so I think right there, we tapped on another place of meaningful change and empowerment is by helping families do just what you all have done, that the 2 of you highlighted. helping them advocate for their, because parents love their children. There's no doubt about that. And they are good at advocating for them in various ways, right? Including when they are advocating for them to push and push and push academically. Question is, how can we reorient those priorities to also help them advocate for what you all did, for the mental health, for balance, and for leaning into the things that have meaning for them. So kudos to both of you. Thank you for sharing both your personal stories. And I think that speaks to a great avenue of where we can make meaningful change as well. And I think that was spoken to in various ways in the data, right? About what does it look like to help reduce stress from parents, right? Who are well-meaning, but there's more to the story. There's more to be said in terms of how we're advocating for our kids. And so on that note, I need to thank you all for the presentation, for the conversation. Thank you, Kevin, for sparking the conversation and for pushing us to go deeper. Now I need to be mindful of time. So I want to shift and open it up to any of our attendees who might have updates you'd like to share, events you have coming up. I do see, Terry, thank you for the flyer for the program you have coming up. I'd invite you, if you're willing, to just speak to it for a moment. And then for anybody else who has something coming up, we'd love to hear about it.
Yes, thank you. Hi, I'm Terry Steele with Ready Set OC. Great to see you. And I loved this topic because I see it often. I moved over to help with the Ready Set OC program because I was very familiar with their work, having the work experience youth over at the Noble Path and with COA, two nonprofits that are part of Connect OC. What I see oftentimes is that stress of going to a university. Many of my participants, they have degrees. Their ages, up to 24, and they come out and they have no job opportunities. And they have stress and they have anger and they're concerned, and they would be in that housing insecure bracket where they're couch surfing with extensive debt. So whatever you guys can do to help educate them while they're in high school, but then also let them know about the programs that currently exist, such as this. Ready Set OC is with the OC Workforce Development. And if you look at the flyer, you could see there's vocational training opportunities, tutoring, paid work experience, mentors, peer-to-peer workshops. We collaborate with all the agencies that are part of Connect OC. But it's getting the information to the youth so that they know these programs exist. This is free. They basically get about $21,000 in services. Most don't even know it exists. And being able to get tours of the community colleges is very important, I believe, as you get this message out for AIM, which is a wonderful program to bring to South OC and all of Orange County, actually, is get to the community colleges so they can also get that information out through their programs. But again, Ready Set OC is a program where we try to help individuals who might have a barrier, and the barriers are very diverse. And when we come up with the personal goals, I would say 95% have mental health as one of their concerns. And they also list the relationship they have with adults is non-existent. So whatever you can do to help in that arena is greatly appreciated, but we're here if anybody ever wants information about what we're providing. We have offices in Brea and here in Laguna Niguel. And so that's what I had to say, but this was one that I was happy to jump on because I'm very interested when I see youth coming up with peer studies, because to me, that's where we get the legitimate information that can help us as adults serve your population better. So thank you.
Thanks, Terry.
You're welcome.
Anyone else? Diana.
Hi, sorry, I've been having technical difficulties all meeting long. So just wanted to also shout out the great conversation we've been having today. Just wanted to echo that sentiment. I also wanted to invite all of you. So I am the outreach coordinator with Casa La Familia. We are hosting an event on June 29th. It is a Saturday in Anaheim at the St. Anthony Church. We'll be in the field. And it is going to be hosting a women empowerment event with resources and things like that for all families, all ages are welcome. So we are waiting for the healthcare agency to finish approving the flyers. So if it's all right with you, David, I'll send it over as soon as I have that approval. But if you guys are interested in also having a table, please email me, reach out to me. I'd love to partner with you guys and, get these resources out to the community. So just wanted to highlight that, but thanks.
Fantastic. Thanks, Dana. Anyone else? If there is anything else that comes up that you didn't get the chance to share this morning, please feel free to email me. The email is in the chat. I'll put it in again. I also want to encourage everyone, if you have the opportunity, if you hadn't gotten a chance to fill out our survey yet, please do. There's my email in the chat. Again, if anything comes up, if you have another event you'd like to promote, send it over. If we've got enough space, I'll be sending it out in the summary email for the coalition, and also we'll add it to our events calendar on the ConnectOC website. Yeah. Other than that, again, thank you to the AIM Youth Mental Health team. Thank you all for joining and for sharing. It's a fantastic program, and the experience that you all have had in implementing it and doing some really really powerful and evocative research. And I think that's about it for me, team. Anything I'm missing before we wrap up for today? All right. Well, other than that, I really hope to see you all in person and for you all to prove to me that you're more than a box in June. And other than that, take care, and everyone have a wonderful last day of May.
Thank you so much.